most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, we're going to show you how to apply traction decompression to the neck or a pinched nerve with a mechanical home treatment device. We've already shown you how to do it manually. We've also shown how to do it with one of the less expensive over-the-door units.
Yep.
But this one, this is a really nice unit. If you're going to be doing traction ongoing for a long time, you probably want to invest in a unit like this. And
Right. They are expensive, but these you can do all by yourself. You can do it safely. They're comfortable, and they're just good. Saunders made it. He is a physical therapist.
Having said that, Brad, though, we would recommend that you try this with a therapist first. Don't, first off, there's $350, so you want to make sure that it's going to help. A therapist will take you through it. Make sure you're doing it correctly. The purpose of the video is to really just have a sheet to help, or a sheet and also guidelines on how to do it after you've been shown.
Right.
So you can reinforce it.
Or you could look at this prior to working with the therapist.
Right.
Then you know what you're getting into.
You can even ask the therapist, and that's what you'd like to do. So it's basically, you're going to first want to determine whether or not you need traction.
Sure.
And we've done this on the other videos, but the first thing you can do is you're going to actually do compression on your neck once on your head to see if that makes your symptoms worse.
Sit up with good posture. Push straight down with your ears over your shoulders. Push down and just see, does that make the pain worse?
Now you can do it with two hands, or you can interlock your fingers and just push down. Does that make your symptoms down your arm worse?
Right.
If for a pinched nerve or any of your symptoms worse,
Right.
then it's a sign that compression makes it worse. Now does decompression make it better? So you're going to hook. If you look on Sam here again. There we go. Mike, can you forget about Gumby? There's these two bumps right here. You all got them.
Right behind the ear.
Right behind the ear. You're going to take your palm, the meaty part of the palm, got one side, another side. Right between those two meaty parts, you're going to hook onto that bump. You're going to do that on both sides, and you can cup your ears, and you're going to pull straight up with your fingers. And
because of the mic on it.
Yeah, we're having trouble.
I'm a little higher, but I should be down. Feel those bumps, and we're just going to go straight up. If that feels like good pressure, that's a good sign that traction like this can be a good option for you.
So that's just a quick guideline to determine whether it's even worth the trial.
Sure.
So once you're ready to go, again, we like the Saunders units only. I guess I haven't tried the other ones. I'm sure there's other ones that are good out there.
Right.
But this one's easy to use. They recommend that your neck normally be like in 15 to 20 degrees of flexion when you're having the traction done. And that's where it is about set there right now.
Right. That's the beauty of the Saunders. It's preset for that.
Yeah, it can go higher. Just down this way, right, Brad?
Bob, you're all thumbed. This is easy to go. Most people can do this easy.
Oh, there we go.
There you go. It's got to click in.
Yeah.
Yep.
All
And
right.
they have a real nice comprehensive instruction book in different
Sure.
languages, and they go through this adjustment as well.
Easy to put down.
No, it is kind of, once you get used to it, it's
Sure.
But once you set, it stays at the same place typically.
So normally the guidelines are you're going to try it the first day, the first session. You could do maybe 3 to 5 minutes. You can stop immediately if there's pain, increased pain. You're looking for the pain, especially if you have pain going on the arm. You're looking for the arm pain to get better first, or the hand pain.
Yep.
You like to see it almost travel up, like it gets better and better as it goes up.
Yep.
If it gets worse in the arm and better in the neck, that's a bad sign.
Right. It's no good.
Things got to get better down here first. So you're going to do the first session, 3 to 5 minutes. You're going to do maybe up to 10 pounds. And Brad will be showing you on this how to determine how much weight you have on there. If that works out okay, the next day you can actually go up to 15 to 20 minutes. And you can do it a couple times a day. You can do it 3 times a day if you want. And you can go up to 30 pounds. They recommend like 24 to 30 pounds if you want to decrease the symptoms. But as Brad says in the past here, he said He goes by symptoms. I mean, if 15
If
pounds
the arm
takes,
pain goes away at 15 pounds,
yeah, why take it higher?
right. Again, you'll see your therapist. They'll go through these. And, everyone has a little bit different
Yes.
take on this. So we're giving you some good general guidelines.
All right. Well, I'll take my mic off, Brad.
Yes.
And then you go ahead and you get this thing ready and start talking about it.
So what we have here is a pneumatic or air-controlled cylinder, which there's a hand pump here. And you'll watch, zoom in on this, Mike, and we'll see how, oops, got it on hold. There we go. These go in those same bones. These cushioned supports go on those same bones. You'll see as Bob gets into it. This strap goes over the forehead. It does not go tight. It just basically lays there. And then when we're done, we adjust this for a release. And you can see how it releases the pressure. There's adjustment thumb screws here, thumb knobs that adjust it so it's comfortable on the back of your head. You ready, Bob?
Yep, I'm ready.
Okay, this way. Okay, so Bob can talk, but we will not hear him. Yeah, loose collar, no jewelry, no glasses. Take all that off. You don't want to have any restrictions. Now, again, I'll have the patient do the pumping, because they have to do it at home anyways. I may start doing it. So, there. You feel that, Bob? All right, and we'll release it. It's going to go back down. This goes over the forehead. Again, you don't have to, it's not a tight strap. It's just keep things so Bob stays relaxed there. I've got this set. Okay, Bob, why don't you, you probably have your glasses off, so it's kind of hard to read that if you have 60-year-old eyes or if like mine, 58. Yep, so we've got, you turn it right here. This is the controls. So we'll put it on, pump, there you go. There you go. There, so you can see it coming this way, putting traction. Bob, if it feels good, I want you to keep going, but don't go past 10 pounds to start with. Right there. Okay. Yep, then put it on hold, and then that locks it. And you just lay there and relax, and I'll talk to the patient, and I'll ask questions like, are the pain or the symptoms in the arm getting better or worse? What's the location? Do you feel it below the wrist, above the wrist? If it started out going all the way down into the hand, my next question is, do you feel it in the hand? If Bob says, no, it feels good in the hand, I don't even feel it to the elbow, it's just up in the arm, that's a really good sign. And as well as we want to monitor what's going on with the neck. It should feel the same or hopefully a little bit better. If the neck feels a little bit worse, but it's feeling much better on the arm, that's good. If the neck is feeling better, but it's making the arm get worse, particularly going down the arm, that's a red flag. It's time to stop and readjust and try it again, or just leave it alone and come back to it the next visit to the therapist. If you feel that at home and the arm's getting better, you need to stop. It's not the right thing. The nerve is actually getting pinched worse for whatever reason. Anything else, Bob? So it is something like we mentioned. It works very well once you get used to it. You can do this very comfortably. I've had patients. I had one patient. At that time, it was years ago. It was $500 for it, and it worked so well with him. His insurance didn't pay. He did buy it, and he used it on a regular basis.
This video, by the way, is a part of a series of videos on neck pain, which you can find at bobandbrad.com. Go to the program section and look for neck pain. You're going to find multiple videos there. Watch the ones that pertain to you.
Right. So you'll do that. The titles will be fairly clear. You can watch that, and then you'll see there's also a PDF printout which gives a review on paper. You get it printed out, and the exercises that we recommend. And we don't have exercises on this one, but and
It'll have the list,
right?
For you.
And the beauty of this whole thing is you can do all this, print it out, and there's absolutely no cost, not even an email request.
Right. This is our gift to you from Bob and Brad.